Yes, hi, good afternoon, everyone. My name is Abdulaziz Sawan. I'm a physician by background. I have more than 18 years experience in healthcare management. I've led different organizations in the private and public sector in the consulting space. Right now, I have a consulting firm that I established. I'm the managing partner of this consulting firm that caters to the pain points that I found in healthcare during my work in the private and public sector. And I understand that process improvement, operational efficiency is a cornerstone for any organization to excel. And I've been exposed to lean superficially. I've never went deep into lean practices, so I'm just interested to learn more on how can lean being implemented. I mean, we all know that lean uh, has tools, but the most important part of lean, I think, lean practices is understanding how to make it happen in a culture that has the tools but doesn't know the know-how of how to link the problems with the solutions. As regards to my hobbies and superpowers, I, uh, I mean, my hobbies reading, playing sports. That was my hobbies. Superpowers. Uh, I think people should tell you what are my superpowers. I don't know what my superpowers are.
All right, we'll
Okay,
come to
thanks.
know. Hopefully, inshallah, we'll be together.
You tell
Yes.
me what are my superpowers. Okay. Yeah.
All right. Abdul Rahman. Abdul Rahman. Yes. Okay, Badr.
Assalamu alaikum. Can you hear me well?
Yes, we can hear you. Please go ahead.
Yeah, I am Badr Abdullah. From Saudi Arabia, Jeddah. I work for King Abdullah, King Faisal Specialized Hospital and Research Center. My role is e-health supervisor, and I'm graduate of health informatics specialist, bachelor degree actually, Canada Calistoga College. My interest to know more about lean. I know so the concept as I was exposed during my studies, the concept of lean is where remove waste and improve efficiency and productivity. Um, what else? Just here for this to know how to implement these concepts and to excel actually lean. My hobbies will be like sport, swimming, also superpower. I think maybe also I'm not sure. Um, I found myself good at system analysis and data analysis. This is the main what has been recognized from my colleagues and work. That's
Perfect.
all, Mr. Muhammad.
Perfect. Perfect. Please continue one by one. I mean, any one of you can just, I don't need to name
Well,
anyone.
my name
Please start. Yeah.
is
While, let's start with you.
Hi everyone. My name Wael Ahmed. I am orthopedic surgeon by profession, and also I'm a senior operation manager of one of the healthcare sector here in Jeddah. I'm responsible for the patient experience, checkup unit, VIB team, and inpatient with coordination with other parties. I'm interested in to learn more about lean because lean is like it is easy to say everybody can know more about lean and how to apply, but I think it is a bit complex in when we apply it in healthcare sector, and especially with the patient experience, and to be with the operation efficiency and overall for all services. So I'm interested to learn more about my hobby. I'm a drummer. I'm a sea level scuba diver. Thank you all.
Yeah, that's interesting.
Thanks.
Thank you, Dr. Weil. Khadija.
Hello, everyone.
Hello.
Khadija. I am Khadija Ahmed. I am background social worker. I am working currently in rehabilitation center in Jeddah. I am interested with the quality maybe since 4 years or 5 years. So I am still juniors with the all experience يعني colleagues that they are here with us. Why I choose Lean? Because I'm working on Focus BDCA. I have a knowledge of that. So I need to have another knowledge with that kind of methodologies. My hobbies is watching documentary and also watching football. So maybe at 10 p.m. you cannot find me today. uh, this is me. Inshallah, we will have a nice weekly meeting. So I will give you
Yep.
back to the next.
Thank you, Khadija. Abdul Rahman. Dawood, Abdul Rahman Dawood. Yes.
Hi everyone. Can you hear me?
Yes, we can. Please go ahead.
I'm Abdurrahman Dawood. I'm a fresh graduate from King Abdulaziz University in Healthcare Services Administration. I'm an admission and ER officer. My experience is like 7 months because I'm a fresh graduate. Actually, I'm here to learn Lean Six Sigma because I think satisfying patients is important thing in healthcare and improve the efficiency in King's College. My
Perfect.
hobbies are a sport guy, play soccer. Yeah, that's all.
Perfect. Thank you. Thank you, Abdul Rahman. Ahmed Al Haidari. Okay, we'll go to Sulafa.
Yes, hi. My name is Salafa. I'm currently a program development and policy advisor at MOH. My background is in speech pathology and health services management and public health as well. I joined this group because I want to learn more about improving health services and patient journeys. My hobby is baking. And if being observant is a superpower, then I guess that's my superpower. Thank you.
Sorry, Sulafa, can you repeat your superpower? I think we missed that.
Being observant, if that's considered a
Being
superpower,
observant.
then
So
maybe.
we all
Yeah.
will be very careful.
Yep. Thank you.
Thank you. Ahmed Al Haidari, you want to continue?
كم باص عندهم
Okay.
في الميدان انزل افعل كم
Okay, we'll move to Maimuna.
Assalamu alaikum.
Alaikum assalam.
I hope everyone is doing okay. My name is Maimuna. I recently joined King's as a biomedical lead in the biomedical department. So I'm interested in Lean Six Sigma because I work in a clinical engineering department in the hospital, and many people may not realize how important it is to make the equipment up and running, and it's directly affecting the patient flow. So even the steps and the processes that are related to the engineers are also, there's things that are important to consider if it's really adding value to the process or not, and are there any ways to consider to remove, and a lot of improvements that needs to be done in that part as well in the hospital. um, my superpower, I still haven't recognized mine. I guess I'm the type of person who tries many different things, but we'll see. Not sure.
Perfect. Thank you.
Thank you so much.
Walid Al
Hello.
Turayb. Yes, hi.
Yes, good morning, everyone, or good afternoon in our time zone. My name is Walid. I am a patient administrator at Patient Experience Department at King's College Hospital, specifically admission office. Actually, my experience was 6 months at King's Faisal Specialist Hospital at several departments. Why I am interested and why I'm here? Actually, as a person who is interested in quality, the first gate to the quality is lean, in my opinion, for so many reasons, such as to avoid the waste for many, like Muda, and for avoiding overproduction, overprocessing, and inventory in motion, also to avoid defects. So I think the best way to enter the quality world is through the Lean Six Sigma. And regarding the superpower, I think my superpower is being a giver. And what makes it superpower, it because in the healthcare, being a giver, that's what makes it a superpower as a giver. Thank you so much.
Perfect. That's beautiful. Thank you. Rihan?
How are you, Alam?
Hello?
Hi. Hello?
Hello. Yes, we can hear you. Please go ahead.
Yes, okay. Thank you for your initiative, Alam. I'm occupational health safety working in King's College Hospital, London. My background about the laboratory management and the quality improvement in healthcare sector. I hope you need to learn more about the benefits of Lean Six Sigma and applying in healthcare to enhancement the process efficiency, reduce the cost, and to career advancement opportunity, inshallah. I'll invest our information through this journey through MBA education, inshallah.
Inshallah. Thank you. Monis?
Thank you.
All right. So if I missed anyone, please step in and we'll move forward. So thank you for your introduction. Let me quickly introduce myself as well. So I'm an industrial engineer by qualification with close to 16 or 17 years of experience now. And I did my MBA in operations management around 12 years back. I started my career with working with the manufacturing industry, and then I moved to oil and gas industry in a pipeline projects in Qatar, Doha. And then I moved to engineering domain, a core engineering domain, working with Siemens in India. So close to 10 to 12 years, I spent working in different background, different diverse industries, manufacturing, oil and gas, and engineering. In 2020, I moved to healthcare in a hospital, core hospital setup. Now, while working in other industries, my domain was same. I used to lead operational excellence, continuous improvement, process improvement initiative across the operations and driving efficiency and improvements in processes. When I moved to healthcare, and I was sort of shocked to see that there's so much of waste in healthcare. There's so much basic waste which shouldn't be there. And I realized the only reason why the waste is in the healthcare is still not being addressed because there's a lack of understanding. The other industries have gone far ahead in terms of how do they optimize their operations. You might have seen industries like digitizing their operations using machine learning, artificial intelligence, and they have become so efficient that You get a car out of a automobile in manufacturing unit every 1 minute. Some of the plants are so efficient, so there's an every 1 minute one car is coming out, going through hundreds of steps. Everything is on time. If you see the safety matrices of oil and gas industries, we all are in Saudi Arabia, and the economy is largely dependent on oil and gas. You did not heard of any major incident in last maybe a decade or so. Nothing has happened. You will not see that someone has died on the rig, or someone has lost his or her limbs while working in so unsafe environment, because they have made their environment so much safe that these kind of incidents are very rare. But when you talk about healthcare, when you talk about hospitals, every every day you have a patient who might die because of some human error, because of some system error. You might have a case where a wrong medication has been administered. You might have a case where actually a patient has got an infection from the hospital. You will every day see that a patient who comes to the hospitals, they keep on waiting, they wait, and they every time they come to hospital, they wait. And everybody knows in hospital, who's working in hospital, that waiting is a chronic problem. Everyone is aware of waiting. Everyone is aware of that there are issues in healthcare. The care is not being provided on time. Sometimes the right care is not provided. But despite knowing all of these, we are not able to uplift the healthcare to a level where it matches the standard of other industries. For example, if you see the airline industries, how many times do you see a plane crashing down? It's very rare. If you talk about in terms of sigma level, Six Sigma will come to. I'll just keep on bringing some topics wherever it makes sense in a context. Six Sigma is a term which it says when a process has achieved Six Sigma, it means 3.4 defects per million opportunities. If you repeat something 1 million times, out of 1 million, only 3.4 defects will happen. Now in airline industry, do you think that's acceptable? It's not acceptable, right? So you cannot have 1 million flights and then you say, oh, 3.4 crashed. So airline industry usually works at a level which is 7 and 8 sigma, which that this is why you rarely see any crash happening. And every takeoff and every landing is an opportunity of making an error. Now, in terms of healthcare, how many defects happen, how many times the patient is harmed because of something not being done in the right way. Probably the healthcare is working at 2 and 3 sigma, not more than that. So you getting the harm while admitted in a hospital, the opportunity and the probability is way higher than actually you're driving a car on the road, or you are taking a flight in a uh, uh, very disturbing weather kind of a condition. So this is the condition of healthcare, but it's not because of we cannot improve the healthcare, because it's so much variable are involved into it. It's not because of it's very complex. It because of we have not seen the healthcare from the point of view of looking at it as a whole, in terms of a system, in terms of processes interacting with each other, and in terms of different variables interacting with each other. So what our intention is now in these going sessions going forward is that we'll tackle all of these understanding of different concepts and different issues in a baby step. I do not want to cover a lot of topics in one day, but we'll go slowly. What will happen is that, maybe after a couple of sessions, many of you will lose interest and think that, maybe this is not for me, and which is absolutely fine. uh, we start with the motivation, and the motivation goes down because our interest is somewhere else, which is absolutely fine. But I would want you, all of you, to continue in this journey, maybe 9 to 10 sessions, and then we'll be at a level actually where all of you can understand the basics of improvement methodologies. And these are very beautiful. These are very fundamental in its nature. And how to drive improvement is not about technology. It is not about using some sophisticated tools. It is so simple. We'll go into that. So today's session, I have divided that will learn about lean history, because we keep on talking about lean, lean, lean. Lean is improvement, lean is process improvement, lean is a methodology, but rarely we are aware of what is the history of lean. See, every mindset and every methodology, every tool, every system, everything has a
Yeah.
history. And if you're not able to understand the history, the background where it originated, we will not be able to relate with the concept, because that concept
عبودي
will
مو
not.
خلاص موسيقى. خلاص
Can you
محمد
please
أرسل أنا قاعد أشتغل هنا. تبى
can you
أرسل.
please mute yourself? I'll mute myself. All right. So first is a lean history. Then we'll talk about the improvement mindset. I hope, can you confirm? Can you see my screen? I'm sharing my screen as well with a slide of today's agenda.
Yes.
Perfect,
Yes.
perfect. And then we'll talk about a need in healthcare, and we will briefly touch upon the seven waste. So we'll not deep dive into so many things today, but we'll just touch upon those basics and the fundamental of what lean is about. And in further sessions, we'll keep on gradually increasing the complexity of topics. At some point of time, we'll talk about Six Sigma statistics. We'll talk about industrial engineering concepts, and we'll talk about some statistical tools as well. So that will come gradually. Maybe you are already aware of what we're going to talk about today, but if even if it is, please listen to it. Maybe there's something that you will learn out of it today. So let me quickly open one of the spreadsheet. So my way of teaching and coaching and presenting is not to go through slides, but rather to make it more engaging with the help of spreadsheets. Can you see my spreadsheet now?
Yes.
Perfect. I'm just
Yes,
expanding
yes.
it. All right. Okay. So this is where it started. I don't know, many of you have read about lean, how it originated. It started with Sakichi Toyoda. And see, it's Toyota, it's not Toyota. So maybe it's an assignment for you. So you can at home search about why Toyota is called Toyota, TA, but not Toyota, because the family name is Toyota. So it started in late 90th and early 20th century with Sakichi Toyota. And he's usually called a king of investors in Japan. He was a very humble person. He was born in a family. His father was a carpenter, and then the ladies and the women's um, used to work in the household as well. And he always believed in making work easier and more efficient. So he the family was invented in sewing those cloths and those threads. So women used to sew the threads. They used to do it manually by hand. And I used to observe his mother and his grandmother and other women, that whenever the thread breaks down, they find it very difficult to put it back. I mean, it was a very, very manual effort intensive work job, and he used to feel that I should do something for them. So what he did was, he invented the first power loom in 1896. And that loom, today it might look very ordinary, but that time it was a breakthrough invention. It was an automatic loom that stopped when a thread broke. It did not start with that. First, it just made an automatic loom that would make the thread. But then he realized that whenever the thread breaks down in a machine, then it's a very chaotic process, because the machine keep on running. Then you need to clear everything, clear the mess, you need to start the machine again. So he thought, this is not helping. And he made a further improvement in that loom, and he invented an automatic loom. So the moment thread broke, the machine will stop immediately. Now that concept become the foundation of Jidoka, which is also called automation with a human touch. Basically, you build a quality into the process, and you prevent defects from occurring. And this is one of the key pillars of lean thinking. Now, one of the example is, I mean, you all have microwave oven in your home, right? microwave oven. And when it is running, when a child, and in a child, or someone else opens the door, so what happens to the microwave oven? Please, you can speak. It's okay. As
It
long as
stops working.
Stop by default.
it
Stop by
stops
default.
working,
Yeah.
right? So what is this? What is this when it stops working? What is this element? This is Jidoka. This is error proofing. Even if somebody would like to make mistake or would want to make mistake, it would not allow you to make mistake. The system will stop automatically. This is the foundation of Jidoka. And I think this is something we you use very often in our day-to-day life in our organizations as well. For example, sometime when you're writing an email, let's say sending an email, and in the to section you don't write the exact email address. Let's say instead of .com you wrote .com. So what will happen? So email will not go immediately. The system will give an error. The address has a problem. So basically, it doesn't allow you to make mistakes. So this is where it started. This concept of Jidoka, basically don't let the defects pass to the next step and let the system do it. That is one of the foundation of lean thinking. So it also implies the early problem solving mindset that Sakiji had. So his focus was on alleviating human burden and improving efficiency. Now, coming next, what happened after that? Sakichi Toyoda did this. Now, the era is early 20th century, which is pre-World War II. And that point of time, somewhere in America, the Henry Ford was already have established a Ford Motor Company. You might have heard about it. There are many old videos on YouTube where a very typical kind of a very simple basic looking car is driving on the road. This is where the Ford Motor started. And the what Ford Motor did was, because there was so much of demand in America, in US, so he established assembly line. Is that you have one kind of a model, and you move the parts on assembly line, and you keep on producing the same model in hundreds and thousands of units. So basically you don't need to change anything. Everything is same. Structure of the car is same, the color of the car is same, the brake is same, the steering wheel is same, no extra feature. It is like one car is a copy of another car, and he was just mass producing it. So what happens in mass production? Your cost goes down. You're making thousands of units.
ابو جابر فين؟
The cost per unit goes down drastically. This is what happens. Let me pull two windows together so that I can see if somebody has raised hand or not.
السوداني خلاص هم يعبوا الجوازات ويغدروا الحراسات من عندهم.
Sorry. Perfect. So So then came Henry Ford, who was mass producing the car in United States, and that was an early seeds of flow and efficiency. So if you talk about assembly line, what happens in assembly line is that everything moves slowly from step A to step B. Every person has a dedicated set of tasks. So when a part comes to that person, he performs his task and move the part to the next step, and then it moves forward until it gets finished, and then they finally do the quality check and it goes to the customer. So it was early seeds of flow and efficiency, and this is where hundreds and thousands of cars were being made in United States. Now come the time in 1920s and 1930s. Now the Sakichi Toyoda told to his son Kichiryu Toyoda, the future is not in automatic loom. The future is in automobile industries. And Sakichi encourages Kichiryo, his son, to enter automotive manufacturing. And then what happens? There was a British company who wanted to uh, buy the patent rights of automatic loom industry, and they did that. They sold the patented rights to the British company, and with the funds that they gathered, they established Toyota Automobile Company. So this is where the automobile part of Toyota started. It was not Toyota from the beginning. It was an automatic loom company. And then now automatic loom company, they sold the share to the British company, and now it started with automotive company. But there was a big challenge in Japan. Japan was a small country, right? So they did not have the kind of resources and money like the US had. So the same model which was working in US with the Ford motor is not going to work in Japan because it was small, and there was a varying demand from the customer. The customer were having a unique demand in terms of what they want in a car. So it was not possible that they would produce thousands of same car and then it would get sold in the market. So they need to cater to the unique demand of a customer. So they need to change the way Henry Ford used to manufacture cars versus how it has to be adaptable to the Japanese infrastructure and Japanese culture and Japanese economy. Then what happens? Then, while actually they were building this, a world war happened and everything was devastated. You know, the supplier base was lost, everything was lost, and Japan was sort of shattered. And Toyota, at that point of time, if you read the history also, there's a Toyota crisis that happened, I think, for the first time, where actually they have to do a layoff in the Japan. So they wanted to build the Japan with the limited resources they have. So during that time they visited US and they intensively studied Ford systems, how the Ford is manufacturing car. And at that point of time, I think what happened, Taichi Ono was in the US and he was in a supermarket. Like we have a supermarket here in Saudi Arabia, Tanoob and Manuel and so many other. What you see in a shelves, there are things which is kept on a shelves, and whenever the customer picks up those items, then it gets replenished. So we don't keep hundreds of stock on the shelves. We keep a limited quantity on the shelf, but there's a replenishment system. Whenever any item is about to get finished, there's a process in place. Somebody would come and replenish that item. And this sort of fascinated Taichi Ono, and this is where the idea of just in time came in picture. So you get what you want to use just in time, not before, not later, actually when you want to use it. And this also became one of the pillars of Toyota production system, just in time, make only what is needed when needed in the amount needed. Jidoka we have already discussed earlier, and then gradually, Taichi Ono started identifying some concepts and he said there's a lot of waste in the processes. And then he brought in a concept of Kaizen, which is continuous improvement. But all of this while maintaining one important principle of lean, which is respect for people. Respect for people. And then what happens? in 1970s and 80s, because this TPS, it did not sort of uh, c- came to its existence in just one day, in 1 month. It took them decades to bring this methodology and to evolve this methodology in a way that it can be used in multiple industries and organizations. Now, in 1970s and 80s, now Toyota started producing cars with very high quality and with very low cost. I mean, all of us are aware of that Toyota cars are famous for their high quality. They are lower in cost compared to others and usually on time. And when they started doing this, and people started noticing that, what is happening in Japan is something different. We don't know what is happening, but they started talking about it. So now Toyota was picking up because of their quality, because of their cost, and because of their reliability. So they were more reliable. The cars were more reliable. They will break down very rarely, and they were easy to maintain as well. Now when this people started noticing what is happening, so what they did was, then in late 90s and early 90s, there were some what I researchers like James Womack, Daniel Jones, and Daniel Roos. They were the MIT researchers. They they started a program, International Motor Vehicle Program, and they wanted to study the global auto industries. And they were invited to different part of the world. They went to the Japan. They also studied Toyota. And after that, they published a book which is called The Machine That Changed the World. I have read this book couple of times. I would recommend all of you, if you really want to understand lean and its origin, you should read this book. It doesn't matter whether you are in healthcare, you have nothing to do with manufacturing, you have nothing to do with automobile. It started with me as well. I did not come to healthcare just because I was in healthcare, or I have any degree in healthcare. As I said, I'm an industrial engineer, but the concepts that I learned from other industries, now it makes my life easy to implement them in healthcare, because in healthcare there's a lot of opportunities. I would recommend you to read this book. Now in that book, this is the first time the lean term was coined. That Sakichi Toyoda, Taichi Ono, Kichiri Toyoda, they never used the word lean. It was not lean at all. It was all like Toyota production system. Taichi Ono may use Toyota production system, but it was their mindset. It was their mindset. It was not a term. They were not focused on a term. But when this book was written in 1980s, in the book they wrote the word lean for the first time, and they introduced it as a lean manufacturing. This is how the word started talking about lean. And then the Western companies and Western organizations, they also started adopting it. So now coming to 1990s to present, now these principles, the principle is of delivering value to the customer, what customer is willing to pay for, and eliminating anything from the processes that does not add value. Now, this adoption of lean principles have gone beyond automobile manufacturing, but rather into healthcare industries, software industries, services industries, government, even banking. A few months back, I was in a discussion uh, with one of the retail head of the SNB Bank in Saudi Arabia. And that headquarter, I think the head office is in Balad, in here in Jeddah. To my surprise, the retail head, when I see, is that all those branches that you see, wherever the SNB banks are, ATM machines are, all those branches, this is called retail operations. The head of those operation is industrial engineer. And there was someone else who was also director of service improvement and quality improvement. His background is also industrial engineer. So you can see how much powerful these concepts are, that not just the people are using the concept, but actually the people who are from a different background, who are industrial engineer, are now leading this vertical in different industries, not in healthcare, but also in banking. A person who has nothing to do with the financial as part of his qualification, now is leading something in financial sector because to drive efficiency, to drive improvement by learning the concepts from other industries, namely industrial engineering and so. So now in the current world, these concepts are being used by many other organizations. And the whole concept is that we want to focus on customer value. And today, as I said, it's a continuous journey. It's never ending journey. Toyota, though started it, but Toyota is still not perfect. Toyota had many crises recently. I think in 2008, there was a big recall crisis where actually a Lexus accident happened in US, and they realized that there was something wrong in the braking system, and they had to recall thousands of cars. Though later on the investigation happened, the NASA also got involved in that investigation. They realized it was not because of something wrong in the car. It was something that was wrong in the process. Because that when that Lexus car was given to a family, uh, what do we call the mat which is below the brakes? That mat was not of the right size. So that mat got stuck on a brake pedal and an accelerator pedal, and the car accelerated without having any control when actually he was pressing the brake because because that pad was over the accelerator. So instead of braking it started accelerating the car, and that led to the accident. But there were a lot of learnings. But my point is that Toyota today is also learning. It's not they're perfect, but it's about the culture of continuous improvement. Now the same culture we are taking to other industries, and same culture will take it to the healthcare side as well. So from a loom desktop itself to a global healthcare system improving patient care, lean began as a response to hardship and grew into a philosophy of continuous improvement and respect for people. That is a history of lean. And when we're learning lean, and we'll learn more tools about lean in further sessions where actually it gets a little bit complicated. I want you to I want you to know, and I want you to understand how lean started. Because lean is about mindset, and I always say it is about mindset. It is not about tools, it is not about forms, it is more about mindset. Now you can relate what is the deep rooted thinking behind lean. And this is when you see people who are actually lean practitioners, they are very motivated, they are very passionate about it. The reason is not because they have learned many tools. The reason is not that they have achieved some certificates, they are green belt, black belt. No, the passionate people you will see in lean field, and I want all of you to be at some point of time, they're passionate not because of these technical tools. They're passionate because they understand the humble beginning of lean. They understand the mindset behind lean. I mean, even if they don't know any tools, but they're able to identify that something is wrong and something needs to be fixed. That is the mindset we need to start to begin with. Now, coming to a mindset part, I will quickly show something, and I want your participation in this also. You can unmute your mic as well. How many of you have seen How many of you have seen Formula One race? How many of you are familiar with Formula One race? You can speak. Yes, please, Abdul Aziz, talk about it. What is your experience with Formula One race?
Yeah, I mean the efficiency with the stops is amazing. I mean that part is a determining factor for the race, and I mean how fast the team actually changes the tires of the car, and the pit stop experience. I mean is
Correct.
yeah. So yeah, that's what pulls me through the race. I mean the race itself. I don't enjoy it. I enjoy just the yes, just the pit spot and yeah.
So absolutely right. So what happens? Let's say this is a circuit, right? And car has to complete the circuit. and they need to, I think, do number of times, I don't know, 30, 50. There's always a count that they need to, and there's the same circuit. They need to keep on completing. So I want to ask all of you, what is the purpose of this? Why everyone is driving their car? What is the purpose? What is the purpose of this everyone driver driving the car? Please speak up. Yeah, I want it to be a little bit engaging. What is the purpose?
To maintain the efficiency of the tire.
Okay.
That's maybe one of the
No, not the reason of the pit stop, but everyone is like driving the car. What they
driving the
want
car.
to, yes,
I think it's a race in the end. So
yes. So they want to win, right?
yes,
will last till the end.
Everyone, so they want to win, they want to finish first. That is the purpose. Now, the question is, what is helping them achieve the purpose? What is helping them is as long as the car is moving, right? If the car is not moving, is it coming closer to the finish line? It is not,
It is
right?
rely on the car quality and machine quality and the maintenance of the car during the
Right.
circuit.
So it depends. What I am trying to say is that the purpose, everyone wants to win the race. They will win the race only when the car is moving, right? If the car is stopped, they they are not coming closer to the end point. So what is stopping them achieve their purpose, basically, which is to win the race, is when the car is stopped. And when the car stopped in the race, as Abdulaziz said, when does it start? When does it stop and stop moving? When does the car stop moving in a race? I want answers
For
from you.
refueling or for maintenance.
When the pit stop happens, right? When the pit stop happens, the car is not moving. Now, what do you want to? I mean, if a pit stop takes 10 minutes, what will happen? And if somebody is able to do it in, say, 5 minutes, and somebody is able to do it in 15 minutes, somebody is able to do it in, say, 2 minutes, this is all makes the difference in a car race. I mean, other than, of course, how fast you drive, the skill set of a driver, they're getting very close in terms of technology, in terms of skills. So every second counts. Now, when the car is stopped, which is happens during a pit stop, it is not adding any value because they are not coming closer to the destination. So it is a non-value added activity. Though it is important, though it is mandatory, because they cannot keep on running the car without doing a pit stop, but still, because this activity stops the car, this activity doesn't bring them closer to the end point. So this activity is still a non-value added activity. This is the mindset I want you to carry forward whenever you will see some things in healthcare. You need to be very, very clear about what do you call a non-value added activity, what is a value added activity. Value added activity is that which is bringing you closer to the purpose, which is fulfilling the objective of the customer. Anything which is not doing it, even if you have to do it, I mean, because there's no way you can skip it. Even if you have to do it, it is mandatory, it is regulatory, it is very important. But if it is not bringing you closer to the purpose, or it is not fulfilling the objective of a patient, it is a non-value added activity. So now what happens? This is a mindset, as I was talking about. So I hope you can see my screen, right? So I'll just play a video how pit stop used to happen in 19. So have you seen how long it used to take? Maybe minutes, 50, 57 seconds, more than 1 minute long back. If somebody would have said to someone that, boss, you're changing four tires, you're cleaning the windshield, you're refueling the vehicle, and it takes you 1 minute, it's too much. What somebody would have said? How long it takes you to change your four tires? Please speak. I want it to be a little bit engaging. How long does it take you to change your tires? Abdul
Maybe an
Rahman.
hour.
Okay. Uh, Walid, how
20,
long does it take you?
20 minutes.
It depends
Perfect.
on the station and the mechanic. But
If
for
I tell you, if I tell you 20 minutes is too much, do it in 5 minutes. What would you say to me?
no way, impossible.
Impossible, right?
Yes.
This is now, if somebody
Mr.
would have
Adam, if
said the
we have
same,
a lot of
yes,
people like this, it would be faster. Yeah.
correct. The point is that let's say if you say it's not possible, so actually it's not possible because it starts with the mindset. Now at that point of time, somebody would have said, "Are you mad? 1 minute is too good to be true," and you're saying it's too much, and they wouldn't have been able to improve it. Can you imagine how long does it take to do this exercise? Any guess, all of you? How long does it take? Any guess? Just a guess, please. All of you. I want to write it
So,
here. Tell
sorry,
me.
can you repeat the question?
Come again,
What do you
Mr. Salman?
think? How long does it take to do the pit stop? Change all four tires,
10
refuel.
seconds.
10 seconds. Yes. Anyone
I,
else?
I think it's between 5 and 7 seconds.
5. Okay. Please. I want to answer from all of you.
I
Khadija.
think
I'd say 12.
12. Maimuna, Riham, Ahmed, Muhammad,
9, maybe.
Wael. Sorry.
9
9.
seconds.
I believe it was 2 to 5 seconds.
Okay. That's it. 2 to 5. Oh, 2 to 5.
I think not more than 10 seconds. I mean, 10 seconds is the maximum.
Perfect. Perfect. So let's quickly have a look at another video, which is the fastest pit stop. And you tell me after this, how long does it take? This happened in Qatar. All right. So how long it took?
Less than 2 seconds.
1.8.
8.
Can you imagine? No. Now,
Oh,
I will close our today's session on this part, which is about mindset. And next sessions will deep dive into the waste of lean waste and healthcare. But what I wanted to make a point today is that as all of you are embarking on a journey of lean, the first important element when you become a lean practitioner is the mindset. You don't say no to things. People would say, Alam, it is not possible, doesn't make sense. People will make all sort of excuses that this cannot be done, this cannot be done, this cannot be done. But you, as a change agent, you need to challenge the status quo. In a hospital environment, when I speak with doctors, physicians, and I speak with the management, and I say that I want to achieve a waiting time of 0 for a patient, and usually people would laugh at me and they say, this is not possible. And I absolutely agree that this is not possible with the resources we have today, with the technology we are using today, with whatever tools and systems we're using today. But it is not impossible. It is possible if you are able to do something differently going forward. When people say that 100% uptime of equipment is not possible, there's always be some defects, some variables that will impact the equipment. It is not possible, so we need to challenge the status quo. This is the takeaway I want you to take from today session is, uh, first is the humble background of lean thinking, which is what is more important, how it originated, and how it is changing the organization. It is not the tools which is changing, it is about the mindset. The reason that Formula One team was able to bring that time from 50 more seconds to 1.8 seconds, because every time they kept on challenging the status quo. They did not stop. They did not say that, no, it's not possible. It's not possible. They kept on improving, fine tuning their process, fine tuning their technique. And it all started with one question. They realized that this pit stop is a non-value added activity. So basically, they need to eliminate it. And that's a mindset we want to carry forward. And we'll wrap up today's session. I'll just take 2, 3, 4 minutes from all of you, and we'll then meet again next Saturday, where actually we'll deep dive into how system thinking can be applied in healthcare in a hospital environment. We'll try to understand from emergency point of view, inpatient care point of view, OPD care point of view. And we'll also deep dive into one more topic, which is the 7 wastes in healthcare, 7 lean waste, and how do you identify the lean waste in healthcare. That will be our focus of next session. Whatever I'm using in this session, these Excels and everything, the history, I'll be happy to share all of these resources with you. So I'll be sharing it in the WhatsApp group so you can take it forward. You can use it for coaching sessions. You can use it for training sessions. So I want to wrap up today's session and want to thank all of you. But one by one, I would want you to take one learning that all of you have taken from today's session. What did you learn today that was something different for you? Please, and then we'll wrap up. Abdul Aziz, let's start with you.
Okay, thank you for the session. It was only 1 hour, but it was very informative. Uh, um, what I got from today's session is two things actually. The first thing is understanding. I mean, for me, uh, from how I looked at it, when I'm looking at the formula race, I thought that the pit stop is the most value added part of the race. I know it's the most important, but it's not the most value added. So, this concept per se that how to name things uh, is important because although it's important, it's not value added. So
Perfect. Yes.
understanding it this way is makes a difference. That's one thing, and the second thing is the mindset, as you mentioned, because um, the mindset actually that was in place within the Formula One, what made it come down from 15 seconds to 3 seconds is the mindset and the mindset of identifying what is value added and what's not value added.
Thank you, Abdulaziz. You summarize it in a very beautiful way. And I would repeat it the same thing that usually when we look at things and people say that, no, but what I'm doing is very important. There's no doubt it is very important. But from a customer point of view, it is a non-value adding activity. So as a lean practitioners, we need to very clear about that when we see an activity, because that people are emotionally attached to what they're doing, they want to defend that what I'm doing is very important and there's no doubt about it. So we don't need to think from our perspective. We need to think it from the end user perspective, the customer perspective. What you're doing for a customer, it is a non-value adding activity. And when you are able to differentiate between value add and non-value add, then you will start challenging the status quo. All right. Thank you, Abdulaziz. Dr. Weil, quickly. Yes.
Uh, okay, really thank you for the informative, really talk that you gave us. It was for me it's very interesting, and thank you, Alan. And that helped that give me that I have to focus in my mindset and how we can eliminate unnecessary steps and waste, as you said, and to foster the problem solving mindset at every level, and to challenge ourselves for everything that can be done in order to make it happen. Because when I saw the formula, it gave me a lot of ideas that a lot of things that can be we can change it and to eliminate the waste, because there is, as you said, there is a lot of unnecessary steps happening in healthcare. It affect badly in the patient journey. Thank you.
Thank you. So I'll not go one by one. Anyone else would like to add, would like to share? Please speak up.
Hello.
Yes.
For me, nothing impossible mindset, and also as it's mentioned by Mr. Abdulaziz, concept of name of thinking, like non-added value.
Perfect. Thank you. Anyone else would like to share the closing thoughts? Yes.
May I add something, please? My takeaway today was that improvement is not always about technology and innovation. I found that very timely. It can be much simpler. Sometimes nowadays in healthcare, we tend to think that using the Internet of Things or digitizing is always the solution, while it can be much simpler than that. Thank you.
Perfect. Perfect. Okay. If none of you has anything more to say, we can close our
Just
today's
for
session. Oh,
minutes,
yes,
please,
please.
Mr. Alam.
Yes.
Thank you. For me, the two most important thing, of course, the first thing, the mindset of no, nothing is impossible. That's the first thing I learned. And the second thing, also that the pit stop, they keep improving, they keep challenging. But also, I learned that they not reaching the 1.8 second until they found the suitable sources, human resources, technical resources, but they found a way out to reach that record.
Yes.
Thank you.
Thank you. Perfect. I think
Okay,
that
Alan.
The,
yes,
this,
Riham.
mm,
Yes.
Yeah. Okay. Um, you let me to imagine how this journey start since 19th and 20th century, and it didn't stop till now. It's still continued, and the effect of positive mindset, which make a big change from impossible to not possible, and soon it will be possible.
Perfect. Thank
Thank
you.
you. Mm.
yes, Assalamu alaikum. We can
Walaikum salam.
reduce the waiting time by improving the resources and the technologies. As you said, this that is not impossible. You can still. That's my concern.
Perfect. Thank you. And going forward, you will see the lean journey is amazing. I mean, uh, as I think Sulafa said, that we don't you need to rely on technology, digital tools. I mean, sometimes some simple basic ideas can do breakthrough improvements. I think it was Sulafa or someone else. Sorry, I forgot. So next session we'll deep dive into specifics of healthcare. We'll understand the ER example. We'll understand through inpatient example, and we'll deep dive slowly. I don't want it to be a very fast paced. I want you to enjoy this journey as I've enjoyed throughout my career, moving from multiple industries to healthcare. I want you to enjoy this journey, even if it takes. I will be with you. I mean, doesn't if this sessions continue after 10 session, doesn't matter. If you want to continue this with me, I will be with you. We want it to be as long, but as slow, but as deep, so that we all understand the beauty, the foundation, and the basics of lean thinking. This is what the intention is. And of course, we'll go into the statistical part, industrial engineering, and the concept Six Sigma, but gradually and slowly. We don't need to rush. It's not about certification, it's about learning. I wish you a very happy day today. Thank you for joining. All right. Assalamu alaikum. Bye.
Walaikum
Thank
salam.
you.
Thank you so much. Bye.